so Mr. Ralph, we're going to go ahead and proceed further into this assessment, and I'm going to listen to your lung sounds in the back, okay? Just need you to turn around for me. All right. I'm going to visualize his back, make sure that everything is intact, the skin is intact, that there's no abnormalities or any issues that are noted, and I don't see any on this one. I'm going to go ahead and ask you to go ahead and take a deep breath for me. Take a deep breath. All right, relax. The lungs are intact, and the back folds are intact, so there's no concerns here. You can go ahead and palpate your back. Make sure that there's no crepitus or abnormalities. Anything hurt when I'm touching? Okay. All right, good. Now I'm going to go ahead and percuss. All right, good. Nothing hurts there?
No.
All right, good. Now I'm going to go ahead and do a CVA check. CVA check is to check for kidneys. If I do a tap, normally if I do a kidney tap, which is called a CVA, and as a pain, it initiates a pain response, that means that the patient usually has a kidney stone. So go ahead and do this. Ready? Does that hurt?
No.
All right, good. So the kidneys are intact. Now I'm going to go ahead and take a listen to your lungs. Deep breath in through and out through your mouth. Deep breath in and out through your mouth. One more time. Okay. One more time. One more time. One more time. One more time. And one more time. Okay, good. Go ahead and lift up your left arm. You're gonna listen to your lung sounds here. Take a breath in, out through your mouth. All right. One time. All right, so I'm gonna listen to two places on the left side because there's two lobes. Go ahead and turn to me. I'm gonna listen to 3 lobes here. Deep breath. Good. One more time. One more time. All right, good. Lung sounds are clear, everything is fine. Now I'm going to go ahead and ask you to say the term 99. Every time I say it, say the term 99, okay? Go ahead and say it.
99.
One more time.
99.
Again?
99. 99.
Again?
99. 99.
All right, good. One more time.
99. 99. 99. 99.
All right, good. All right, go ahead and lay down for me. I'm going to do an assessment of your abdomen.
Lay down on my back?
Yes, please. So once he lays down, I'm going to go ahead and take a look at his abdomen. We're going to expose normally, but for the purpose of the video, we're not going to. What I'm looking for is a symmetrical abdomen that is not anything abnormal, such as a protrusion or anything abnormal, and that's what I'm looking for upon visual inspection. I'm going to go ahead into the top of the bed. Go ahead and raise your head and take a breath and hold it. All right, so this abdomen is symmetrical. Now I'm going to go ahead and auscultate it. Any abdominal pain in the past couple of weeks?
No.
All right, good. Just relax. Auscultate 4 fields. And what I'm listening for is bowel movements. They could be hyperactive or hypoactive, or I can hear none. And at this time, Mr. Ralph's bowels are active. All right, I'm going to go ahead and listen to his aortic, which is about 2 inches above his belly. Okay, and I'm going to listen to his iliac. Actually, I'm going to listen to his renals, which is 2 inches above with his aorta, and then an inch over to the right and left sides. Alright, good. Now I'm going to listen to his iliac, which is about an inch below his belly, and to his left and right sides. Alright, good. Okay, now I'm going to listen to deeper sounds. I'm going to try to listen to his renal arteries. What I'm trying to hear for is a pulse or anything abnormal like a swish. Alright, good. Everything's intact there. Now I'm going to go ahead and percuss. Let me know if anything hurts. Anything hurt?
No.
Okay, now I'm going to go ahead and palpate your abdomen. I'm looking for your liver, making sure that I feel your liver borders. All right, good. All right, your stomach and spleen. Your small and large intestines. And normally, if a patient has a complaint of an abdominal pain, I would go to that at the last. I would palpate the last one. So now I'm going to go ahead and do a deeper palpation. So you ready for this? You might be a little bit uncomfortable. All right, good. Anything hurt while I'm palpating?
No.
All right, good. Go ahead and sit up for me now. And face me on the chair. Okay. Now I'm going to ask you to move your face against my hand. Go ahead and turn to your left. All right, turn to your right. Now go ahead and shrug your shoulders for me. Shrug your shoulders. All right, good. Now I'm going to go and ask you to touch your fingers to your hands, your thumb to your fingers, like this. Good, 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 good. All right, excellent. Now, I want you to touch your nose into my fingers. So you're going to do this, all right? Ready? Excellent. All right, good. Now I'm going to ask you to go ahead and take your heel and move it right up against your heel, your shin. And do the other side for me. Good, good. Now, go ahead and move your hands to your knees, and you're going to do one of these. Touch your knees to your hands. Excellent, excellent, excellent. All right, good, good, good. Now I'm going to go ahead and check his reflexes. I don't have a striking tool, so I'm going to go ahead and show you how. So I'm going to ask his arm, and I'm going to ask my patient to relax his arm in a neutral position. I'm going to cover this area, and I'm going to strike this area, and I should see a reflex where his hand jumps up, okay? And I'm going to do it on both sides. As far as the patella, I would go ahead and strike right in this area, and I would see a reflex in this area as well. And since I'm down here, I'm going to go ahead and ask you to, I'm going to do a sensory motion of the big toe. What this means is I'm going to move your big toe up, left and right. This is up, this is down, this is right, and this is left. All right? Go ahead and close your eyes. Let me know where your toe is moving.
Down. Up.
All right, good. I would do a vibration sensation on your big toe, and what that entails is getting a tuning fork and putting it right on the big toe, right where the knuckle is, and then I would hit it and then touch it, and then I would ask him to tell me when he feels the vibration stops. So I don't have that, but that's simulated. All right? Good, good, good. All right. Now go ahead and ask you to stand up for me. Stand up with your arms to your side and close your eyes and just try to stand as still as possible. And this is the Romberg test. All right, good. Oh, go ahead and open your eyes. Now go ahead and just take a walk for me up and down. Just a normal walk. And this is assessing his gait. Come back. Okay. The next time you walk up, I want you to walk heel to toe, and then back as well. Okay, now come back. All right, go ahead and have a seat, and this concludes our video.